Hi friends, good evening. Once again welcome back to my channel Mogambiga Nursing. Friends, here we are discussing important and previous year questions for nursing officer exam. Already we completed 9 parts. If you are watching first time, kindly go through my previous videos, and if it is useful for your studies, please share my videos to your friend circle. Also subscribe my channel and support me. Let's see the questions. Today's first question. A child came in emergency with acute bronchospasm after a breast. What is most preferred route of adrenaline administration? Options. Option A intrathecal, option B intravenous, option C intraspinal, option D intramuscular. Here the question is, a child brought to the emergency department with bronchospasm after a bee stick. This is bee is an insect. So after an insect bite, the child got bronchospasm and brought to the emergency department. This is one of the anaphylactic reaction. Okay. So the child will get injection adrenaline. So the injection most preferred route for this injection adrenaline is intramuscular. Option D is the correct answer. Why intramuscular means? For an allergic reaction, usually injection adrenaline is given intramuscularly. It will help for rapid absorption. So the correct answer is option D. Here the patient is child. So it is given anterolateral aspect of the thigh IM route. Okay, option D. Move on to the next question. Which diet should avoid in acute renal failure disease? Options. Option A protein, option B carbohydrate, option C fat, option D vitamin. The diet which should be avoided in acute renal failure is protein. The dietary intake we can see, we can provide very low protein diet, that is moderate to low protein diet, that is 30 to 50 gram per day. This is mainly to reduce the workload of the kidney. We can give high carbohydrate diet, that is 300 to 400 gram per day, and moderate fat diet also we can give, that is 70 to 90 gram per day. We should avoid protein rich diet. Okay, option A is the correct answer. Move on to the next question. Which type of bandage is used in ankle injury? Options. Option A figure of 8. Option B circular bandage. Option C reverse. Option D spiral bandage. The type of bandage which is used for ankle injury is figure of 8. Option A is the correct answer. Move on to the next question. Drug of choice for amoebiasis is options. Option A penicillin G, option B chloramphenicol, option C metronidazole, option D all of this. And the correct answer is, it is metronidazole. Option C is the correct answer. Drug of choice for amoebiasis. Amoebiasis is caused by Entamoeba histolytica. Move on to the next question. Drug used for hookworm infection is options. Option A albendazole, option B metronidazole, option C mebendazole, option D both A and C. The question is drug used for hookworm infection. Hookworm or worm infestation, we are giving albendazole or mebendazole. Okay, so the correct answer is option D, both A and C. The deworming is mainly focusing on the age group 1 to 19 years. For 1 to 2 years, 200 milligram tablet is giving, and for 2 to 19 years, 400 milligram tablet is giving. And this is giving at an interval of 6 months. Okay, this is deworming. Move on to the next question. Worm infestation which is transmitted through meat is options. Option A hookworm, option B tapeworm, option C roundworm, option D pinworm. And the correct answer is, it is tapeworm. The worm infestation which is transmitted through meat is tapeworm. Tapeworm is Tinea solium and Tinea saginata. In that, Tinea solium is known as pork tapeworm and Tinea saginata is known as beef tapeworm. Move on to the next question. The neurological complication of DPT vaccine are due to options. Option A pertussis component, option B diphtheria component, option C tetanus, option D all of this. DPT vaccine is diphtheria, pertussis and tetanus. Okay, in that neurological complications are occurs due to pertussis component. Okay, due to pertussis. Option A is the correct answer. And diphtheria component causes hypersensitivity reaction, and tetanus component causes brachial neuritis, and neurological complication is due to pertussis component. Option A. And the next question, vitamin D helps in the absorption of options. Option A sodium, option B potassium, option C calcium, option D manganese. Vitamin D helps for the absorption of calcium. Option C is the correct answer. And the next question is, intermittent claudication is seen in options. Option A angina pectoris, option B aortic aneurysm, option C myocardial infarction, option D peripheral arterial disease. Intermittent claudication or pain in the muscles resulting from inadequate blood supply. Okay, this is mainly due to peripheral arterial disease. Option D is the correct answer. The main signs and symptoms of this peripheral arterial disease is intermittent claudication. Move on to the next question. The immunoglobulin present in colostrum is options. Option A IgM, option B IgG, option C IgA, option D IgD. And the correct answer is, it is IgA. Option C is the correct answer. IgA immunoglobulin is also known as secretory immunoglobulin. It is mainly present in the colostrum, saliva, tears, respiratory secretions, and intestinal juice. This IgA provides localized protection against microorganisms because it contains lysozymes. Okay. Move on to the next question. Epidemiological marker of hepatitis B is options. Option A HBsAg, option B anti-HBc, option C HBAg, option D all of this. And the correct answer is, it is HBsAg. Option A is the correct answer. The epidemiological marker of hepatitis B is HBsAg. Move on to the next question. Pre-exposure prophylaxis for rabies is given in an order. Options. Option A day 0, 3. Option B day 0, 3, 28. Option C day 0, 3, 7, 28 and 90. Option D day 0, 3, 7, 14, 28 and 19. Here the question is pre-exposure prophylaxis, that is before exposure. Okay, the order of vaccine is rabies vaccine is day 0 day, 7th day and 28th day. Option B is the correct answer. This is pre-exposure prophylaxis. We can see the treatment prophylaxis. For the treatment of rabies, ARV vaccine is giving. ARV means anti-rabies vaccine. ARV can give intramuscular or intradermal. Suppose if intramuscularly giving means 0.5 ml in deltoid muscle. And the dose is 0, 3, 7, 14 and 28th day. Okay. If it is giving intradermally means at a time a right hand 0.2 ml and left hand 0.2 ml. Okay. This is in case of intradermal. And the days is same like intramuscular 0, 3, 7, 14 and 28th day. Move on to the next question. The causative organism of filaria is, our options. Option A Ascariasis, option B Vaugeria bancrofti, option C Plasmodium, option D Tinea solium. And the correct answer is Vaugeria bancrofti. Option B is the correct answer. The causative organism of filaria. Filaria is also known as elephantiasis. Okay. And the next question is, which of the following food contains high fiber? Options. Option A wheat, option B whole grain, option C spinach, option D all of this. Our question, among this option, which is high fiber diet, it is whole grain. Option B is the correct answer. And the next question is, most common type of episiotomy performed during labor is options. Option A right mediolateral, option B J-shaped, option C lateral, option D medial. Episiotomy is a planned incision on the perineum and the posterior vaginal wall during the second stage of labor. Okay, episiotomy is also known as periotomy, and the types include mediolateral, median, lateral and J-shaped. Our question is, most common type of episiotomy is right mediolateral or mediolateral. Option A is the correct answer. This mediolateral episiotomy is relatively safe from rectal involvement, and also it can extend. If it is needed means we can extend the incision. So the most common type is mediolateral or right mediolateral. And the next question is, the benign tumor of blood vessels is called options. Option A hemangioma, option B lipoma, option C myoma, option D adenoma. The benign tumor of blood vessels is known as hemangioma. Hem is blood. So it is hemangioma. Option A is the correct answer. Move on to the next question. A rapid infusion of insulin causes options. Option A hyperkalemia, option B hypernatremia, option C hypokalemia, option D hyponatremia. A rapid or fast infusion of insulin causes hypokalemia. Option C is the correct answer. Move on to the next question. The lifespan of a sperm is options. Option A 0 to 12 hours, option B 12 to 24 hours, option C 24 to 48 hours, option D 48 to 72 hours. Correct answer is among this option D is the correct answer, but the sperm can survive up to 5 days. Move on to the next question. The volume of amniotic fluid at term is options. Option A 100 to 200 ml, option B 300 to 500 ml, option C 600 to 800 ml, option D 50 to 100 ml. And the correct answer is at term it is 600 to 800 ml. By 12th week the amount of amniotic fluid is 50 ml. At 20th week it is 400 ml. By 36 to 38 week it is 1 liter, that is gradually increasing and at peak level, that is 1 liter, and thereafter the amount will decreases and at term it is 600 to 800 ml. If the pregnancy continues, that is like post term, that is after 38 week, the amount will again decreases and it will reach up to 200 ml at 43 weeks. Okay. Move on to the next question. Dark brown color of amniotic fluid indicate options. Option A post maturity, option B intrauterine death, option C RH incompatibility, option D accidental hemorrhage. Dark brown color of amniotic fluid indicate it is intrauterine death. Option B is the correct answer. Golden color of amniotic fluid indicate RH incompatibility, that is option C. Greenish yellow means post maturity, that is option A. Dark color of amniotic fluid indicate it is an accidental hemorrhage or concealed accidental hemorrhage, and dark brown color is our question, that indicate intrauterine death. And the next question is, the antidote for heparin is options. Option A vitamin K, option B warfarin, option C N-acetylcysteine, option D protamine sulfate. And the correct answer is it is protamine sulfate. Option D is the correct answer. Antidotes are important area. We can expect 1 mark question from antidotes. Move on to the next question. This is the last question. Redman syndrome is associated with the use of options. Option A vancomycin, option B tetracycline, option C chloramphenicol, option D erythromycin. Redman syndrome is due to the use of vancomycin. Option A is the correct answer. So here we discussed important and previous year questions. If it is useful for your studies, please share my videos to your friend circle.